Hi, this is Tom Shannon. I'm going to talk briefly about the procedure for a prostate biopsy. The reason that we would recommend a prostate biopsy is to either diagnose or exclude a prostate cancer based on the PSA test and the rectal examination. Biopsy is a very simple test, and it relies on the fact that the prostate is easy to feel through the back passage. It's also easy to see on ultrasound through the back passage. The biopsy is typically uncomfortable, so is performed under an anaesthetic. Once you're asleep and in position, an examination of the prostate is performed again, and an ultrasound probe is inserted into the rectum, which gives us a very clear view in 3 dimensions of the prostate gland. Once we have this view, we take some pictures and some measurements, and then we take some samples, and typically 16 biopsies will be taken in a standard set, which is quite a few. And we're doing this to ensure that we have the most accurate map of the cancer and to reduce the chance of missing any disease. As you will be asleep during the procedure, it's important to understand that you must fast for 6 hours before. The anaesthetic is very effective, and you will not know that the procedure is occurring, and you will not feel any pain. Most of the pain is during the procedure, and although some dull discomfort can occur afterwards, we generally don't see too much trouble. You can't drive yourself home after the procedure, and we'll need to have someone pick you up. It's common to have some bleeding after the operation, and we expect that you'll see some blood in the urine and even in the back passage for around 2 to 3 days. This can often disappear and then reappear again once you're active. What is not normal is having significant numbers of clots or finding it very difficult to pass urine. We also tend to see blood in the semen. This is not fresh bleeding, but blood that is trapped within the prostate and is very slow to be released. It's not of any consequence, but can be distressing in appearance. Our infection rate is currently around 1 in 500, but true septicemia can occur following a prostate biopsy. If this does occur, this is considered to be a significant complication, and you must return to hospital. You would be unwell with high fevers, sweating and headaches. It generally would occur in a delayed fashion, about 24 to 48 hours after the procedure, and you should contact the hospital directly and speak to your treating urologist. If you do get this infection, then intravenous antibiotics are usually required, and therefore we don't recommend seeing your general practitioner or attending an emergency department. To prevent infection, you will have an enema before the procedure that you will use at home to clean out the lower bowel. We'll also use a suppository, which is made from betadine, which will sterilise the lower end of the bowel and has significantly reduced infections in our hands. You'll also have oral antibiotics, which will begin an hour before the biopsy and continue for 2 doses over the next 12 hours.